Hi, everyone. Welcome to Leadership at the Forefront of COVID. I'm Dr. Pendo, Senior Medical Director for Experience of Caring at Intermountain Healthcare. And today I am pleased to be speaking with Dr. Allison Suttle, the Chief Medical Officer at Sanford Health. Welcome, Allison. So good to have you here today.
Thanks, Ann. It's great to be here.
So we're going to start the way I always start, which is describe your Chief Medical Officer duties before COVID and what changed for you when the pandemic started for you at Sanford Health.
Yeah, so prior to COVID, obviously, I had a lot of different projects and different initiatives that I was working on. And, a lot of exciting stuff and integrating new technology and using artificial intelligence, algorithms to change how we practice, a lot of different projects that were going on. And it was, I believe, March 11th when we started Incident Command, and it was a 12-hour day and 7 days a week at the very start there, really just quickly getting ready for those worst case scenarios. So I think you kind of go back and look at your calendar pre-COVID to COVID today and kind of reassess what your priorities are. You go back to kind of the basics of food and shelter, when there's the pandemic, and to make sure you've got all that under control before you can start kind of moving on to the next things. But we never get too far away from food and shelter right now with the surge in number of cases that we're seeing.
Yeah, so as you think about, you mentioned your priorities. What would you say for you today is your number one priority that you're focused on, in addition to the food and shelter that you mentioned?
So as a system, our number one priority right now is staffing, and we are seeing increasing numbers of cases, projecting what those numbers could be depending on behaviors that happen over the holidays, and just anticipating a certain amount of staff that's out sick because of this being so widespread in our communities. So it's really the staffing, not just that we have adequate staff, but that we have healthy, adequate staff, the healthy staff that are not just physically healthy, but emotionally healthy. So just the how long we've been at this and the staffing needs that we have. So the way we're set up at Sanford is we have, we're very rural, and we have major medical centers in different locations. We call those markets. So in Fargo, North Dakota, in Bismarck, North Dakota, in Bemidji, Minnesota, and then in Sioux Falls, South Dakota. There are many clinics and critical hospitals around all of those different regions, but those are our different regions. Those regions do the core work that they need to in their markets. And here at the corporate center at corporate Sanford, we're a service to those markets. So how do we help those markets do what they need to do? So we're looking at different and creative ways to help cross-train nurses. How can we do that in a quick way that's efficient, and then provide that as a resource to those local markets? And how do we provide connections to our communities for community resources that our physicians and nurses might need to help with having easy access to instead of having to go to the grocery store, can we, package up their groceries and have them waiting for them at the hospitals when they leave work? Those kinds of things. How can we help with that?
Yeah. As you're speaking, I'm reflecting on that sense of urgency, right? And really getting the sense that the work that you were doing at your corporate center, really with the belief that what you were doing was critically important for those in your markets, and then those in the people in those communities.
Absolutely. It really felt like I'm not on the front lines anymore, but the work I'm doing is going to help those frontline staff. It was a big team effort. And that sense of urgency that you talk about, I think, tends to also break down barriers. If it's one thing I've learned about COVID, is when everyone's working on one thing and one thing alone for a week or 2 weeks, suddenly those barriers that used to make it, well, we can't really get that off the ground, or that telemedicine project isn't working because of this. Okay, well, we'll talk about it next month. That sense of urgency that no, we can't take no for an answer. We have to figure this out now, and we need the solution next week. Um, how do we capture that, and how do we maintain that sense of urgency, because our patients deserve it. They really deserve us to bring solutions to the table and to the bedside sooner. So how do we keep that sense of urgency around one project when there isn't COVID? That's something that I'm going to take away from this experience, to really try to get my teams to focus on one thing, not take no for an answer, to figure out what's the yes and how do we get to that yes, to get this executed.
So as you talk about getting to that yes, my motto is what can we do? There are always barriers. So that ability to think about what can we do has been invigorating and energizing, as opposed to draining, because I believe that there's always a way to get to yes, as you said. So those long days, those 7 days a week, work weeks, how are you taking care of yourself during this time?
I wasn't doing a very good job at the beginning, I will tell you that. But you quickly learn that you can do anything for only so long, and then it starts to add up. You do have to take care of yourself. So a couple of the things that I've been doing, working out at home, which I didn't used to do. I used to always go to the gym. So finding a way to do a workout at home. And and then I've also found connecting with, in terms of relationships. When I haven't been able to just go out with friends here in town, I've realized that I've connected with them differently, but I've also reinvigorated some of these relationships that go way back to medical school years, back to college years. And I've started writing more letters, actually, writing letters to old friends.
I love that. We just have a minute or so left. Can you share with our audience what you've learned about yourself and as a leader during this time of the pandemic?
I think what I've learned about myself is that I like to have multiple projects going on, and I get excited by something new, and I want to bring something new on board. And I kind of got lulled into that. We'll meet next month. We'll make tiny steps of progress, but I'll do that on 4 or 5 different things. What I'd like to do is really kind of redirect those energies into one major initiative. Obviously, there's always, keeping the lights on work that you have to do every day. But what's the one initiative, or the one thing that I want to get done in the next 100 days? And how can I rally my team around meeting weekly and really creating that sense of urgency, and that let's get to a yes? How can I do that when we don't have a pandemic on our hands? So I think that's something that I'd like to focus on. And I think I do that in my personal life as well. I think I tend to have a lot of things going on and not be in the present and focused on the one thing that I'm doing right now. And to really keep the time going a little slower at home and take the time to enjoy something, rather than scheduling 5 or 6 errands to run in a day, maybe scheduling a couple, taking more time to do them, doing more journaling or letter writing, some of those things that take more contemplation. I find them more satisfying than just the quick exchange of text messages and emails.
I love that. Good reminder for us all to slow down. Thanks so much for spending time speaking with us today. We will look forward to speaking with you again in the future, and looking forward to seeing all of you in our next episode of Leadership at the Forefront of COVID. Take care. Thanks, everyone. Bye-bye.